Hello, I'm Dr. John Perlman, Beverly Hills and Extreme Makeover plastic surgeon for ABC Television. I wanted to take a few minutes to discuss some details about the use of botulinum toxin, commonly known as Botox or Xeomin, a competitor, for the use of wrinkles of the face. There are so many uses for Botox, and it has such great potential that people are unaware of, that I thought spending a few moments discussing some of the options that are available to you would be helpful. Most people are aware of the fact that Botox is almost a wonder drug for crow's feet. The wrinkles that we get when we smile that start to occur in their late 20s through 30s up until, of course, the 60s and 70s, they become increasingly noticeable. And removing the crow's feet, or certainly weakening them, can have a really surprisingly beneficial effect when you're talking to people, when you're taking photographs. It's kind of amazing. I really encourage my patients to try it, even if they're uncertain, because so many people are happy that they've done it. A side benefit of reducing the contraction of the muscle in the corner of the eye is that it allows a little elevation of the side of the brow, maybe a couple of millimeters or a fraction of an inch. That in itself opens up the expression a bit and takes away some of the excess skin lying on the upper eyelid for many people. So the use of Botox in the crow's feet is a wonderful application for it, very beneficial. People also use it for the frown lines, the vertical lines that form from the muscles in this area that wrinkle the brow and bring them together. Here too, there's almost no side effects or complications from the use of Xeomin or Botox in that area. And again, most people who are bothered by the vertical furrow lines or are told that they look stern and angry usually get a very nice improvement and are very happy with it. Occasionally, one of those muscles is unusual in its location, and it's impossible to get rid of the contraction completely, but that's fairly rare, actually. So it's a very good indication. Many people want the forehead wrinkles, the horizontal forehead wrinkles, either weakened or eliminated with Botox. I favor being very cautious here because it's nice to still retain some movement of the brow to contradict the idea that somebody's face is frozen from the use of Botox. So if the brows still move and one can show some degree of expression, it's a very natural appearance and a very youthful appearance because the wrinkling generally goes away or is significantly diminished. This is an area, though, if too much Botox or Xeomin is applied, the brow can become frozen, which is bad, or it can even become droopy, which is uncomfortable and unpleasant. So I tell my patients that I want to be conservative in the use of these botulinum toxins in the forehead. And patients can always come back in a week or two on the rare occasion where it's necessary to add a little bit. In summary, you can add, but you can't take the Botox away, so we don't want to overdo it in the horizontal forehead wrinkle area. Other areas for proper and common use of Botox is very popular would be the upper nasal bridge, the bunny lines, which a lot of us have, as well as under the corners of the mouth. If you see somebody who has depressed corners of their mouth, it's kind of a convex downward slope of their lower lip and mouth, by relaxing the muscles that pull the corner of the mouth down with Botox, one can actually elevate the corners of the mouth very, very aesthetically, very nicely. Another popular but less commonly known area for the use of Botox is the muscle bands in the neck, the platysma muscle. As one ages into the 40s and 50s, a little muscle spasm occurs, and you see these bands in the neck that many people believe is simply droopy skin, but in actual fact is caused by contraction of a band of the pectoral muscle. It's very common. Injecting this cautiously with Botox, small doses, can really eradicate those bands and make a neck look much, much younger and nicer looking in contour. Finally, I would also mention that dimpling of the chin can be reversed by Botox. The mentalis muscle inserts to the skin here right in the middle, and many people are bothered by puckering of that area, and Botox is wonderful to eradicate it. So that's a pretty good summary of common uses of Botox. If you have any questions, feel free to call my office. If you'd like to make a consultation, you can reach us at 310-854-0031 or visit my website, www.perlmanmd.com, for more information. Thank you so much and have a good day. Thanks for your time.